One of our favorite cases using Implant Studio was a case where we were able to provide our patient a very predictable, safe, and efficient form of implant treatment, all done the same day. We're able to take the patient's preoperative scan as well as the patient's 3D X-ray and very efficiently combine that together within Implant Studio. It allows us to make sure that we can take the different data sets and accurately combine them to make sure that the virtual implant planning is very accurate as well as very predictable. A big part to any implant planning is for us to prosthetically plan where we want the implants to go. We want to work in reverse. We want to be able to take our teeth, set up our teeth where we want them to end up, and then put our implants in the position relative to those areas. A big advantage with the 3Shape Implant Studio workflow for us is the ability for us to take this information, create a surgical guide, as well as take that information and bring it back into the dental design software before we actually do the surgery. The major advantage is that with these different data sets, the patient's upper jaw, the patient's lower jaw, the virtual implant position prior to the surgery, the restorative components we want to use, all of that comes together so that we can go ahead and prior to finishing the virtual plan, we can even go ahead and design a screw-retained provisional or even a provisional that is of the precision of where the implants will end up so that we have a very nice way of immediately providing a restoration for this patient. So you see that Implant Studio gives us, prior to the surgery, very accurate planning, the implant guide that we're going to be producing and using for this patient. It's going to give us the final restorative design before the surgery, as well as even provide for us an implant level model that we can have in our hands, fully digitally manufactured prior to any treatment.
A lot of gaggers. It's really difficult for them, and I really feel bad for them when they have to have all this gook in their mouth and trying to keep it in the mouth for at least 7 minutes, and you have this poor patient gagging. Now having the Trio scanner, it's been so much better for the patient.
It's definitely more pleasant. It's more easier, and it's much easier, and it seems to me like I feel like the experience is less severe, less threatening.
And it's very comfortable. It's not uncomfortable like the gel used to be.
The old way was much more complicated. It entailed putting goop in your mouth and pushing it hard and making an impression, and it wasn't particularly comfortable.
I always show the patient afterwards what we just did, because they ask me, well, what are you doing and what is that? And they're quite amazed every time they see the screen. Yeah, they love it.
It's amazing. It's very, it's in color, and and it moves, and with a little switch they could just make it go up and down and around. It's amazing.
Fast is always better in New York.
Am I that busy? Am I that busy? Yeah, I'm that busy. Yeah, I'm a New Yorker. We're busy people.
curve with using the Trios unit was non-existent. It's so easy to use. Essentially, I picked it up, and from the very first moment that I did, I was able to take a full arch scan without having any issues whatsoever.
It's very intuitive. People that are learning how to use it, doctors, assistants, hygienists, take to it very quickly.
The Trios workflow is very easy. I mean, it's intuitive. From start to finish, you can take a scan within seconds, get the information that I need, and have that information available to me whenever I need it. There's no problems with capturing the lip, capturing the tongue. The Trios unit knows itself intuitively how to eliminate those interferences, if you will, so that it captures only the information that I need to get the work done. It really allows me to have a better use of my time by letting the assistants use the Trios unit. And because the Trios is so easy to use, I can be very confident about them using it.
I've used many scanners over the years, in fact most scanners, and I can say for sure that the Trios is one of the easiest ones to learn how to use.
Any dentist that has reservations with going digital, if they have a smartphone, they can use a Trios unit that much easier.
This video will demonstrate how to use the new patient-specific motion feature. Patient-specific motion will allow you to record the true movement of the patient with the TRIOS scanner. This will enable the dentist to view not only the static contact points, but also the dynamic contact points of the patient. This information will help the lab to create even better fitting restorations. When entering the scan page, you will notice the new patient-specific motion step in the workflow bar. Scan the lower and upper arch along with the bite scan, the same way as you are used to. After completing the bite scan, click Next to go to the patient-specific motion page. Make sure you create the patient-specific motion scan only in the side where you want to make the restoration. Start scanning at the blue marked area. When the area turns green, instruct the patient to start grinding the teeth in the desired direction. Make sure to keep the scanner at the same position while the patient is grinding the teeth. When you are satisfied with the recorded motion, stop the scanning. It is now possible to replay the movement of the patient by clicking the play button. This will replay the actual movement of the patient. Select the Change View button to view the actual contact points of the patient. The blue marked areas will show the static contact points, while the red marked areas show the dynamic contact points. Proceed to the Send page and send the order to the lab the same way you are used to. We hope this was helpful, and thank you for watching. Welcome to this How to Scan for Surgical Guide series, where we will explain how to scan for a particular case. In this video, we will show you how to scan a patient with a single implant. Here we have a missing first molar. The region has several anatomical structures that have to be taken into consideration. So we're going to use the TRIOS to scan the quadrant to facilitate implant planning and the design of a tooth supported with a surgical guide. After adding your patient, start a new case and select the laboratory of your choice. This laboratory will manufacture the guide later. Set up the order form for implant planning. Start by marking the desired region. Here we mark tooth number 36 and open the Implant Planning tab. You should also mark Implant Planning and Surgical Guide in the corresponding menus. Click Next to go to the scan page. When scanning for a tooth-supported surgical guide, it's important to scan the teeth, but also the soft tissue in the region of interest. And not only the top surface of the crest, but all the way down on the sides. Start your scan from the occlusal on the most posterior tooth, following the official scan strategy. When turning lingual, try to go as deep as possible, using the tip to push the tongue aside. If possible, with a 70 to 80 degrees angle, so that the scanner can grab images of the whole crest. Turn to the buccal side, covering the area behind the molar, the retromolar area, in case we need the support for the guide. Go buccal again, as deep as possible, with a 70 to 80 degrees angle to also cover the soft tissue. Now we have a digital model with enough height on which to stabilize the guide. We also have a good view of the soft tissue. This is important to get a good understanding of the surrounding areas. Please note that, for a successful and a predictable outcome, it is imperative that the implant site and the surrounding areas are fully covered by the scan. If needed, go back and cover the missing areas. When we now look at the digital model, we can see that we have got about 15 millimeters of the surface that we can place the guide on. Remember to scan the quadrant so you have the freedom to rest your guide on as many teeth as possible to get the desired stability. You have now learned how to scan a patient with a single implant. We hope this was helpful. Thank you for watching.
The most difficult thing to communicate with the patient is the end result. With this new smile design from Trias, it's fast. It also looks very natural. In this way, the communication is so simple. It's so easy to be an architect. There's benefit for the doctor because it's very intuitive. It is fantastic to communicate that in 2 minutes.
My name is Samantha Mora. The smile design actually was the reason I went through with the treatment. The first time I saw the smile design, I was in shock because for so long I was so self-conscious about my smile and could never envision it being anything else. For me to be able to see right away, like, this is what my smile is and this is what my smile could be, it was emotional for me. I called within 2 hours and I was like, I'm moving forward with this treatment.
One of the major advantages of intraoral scanning for digital implant treatment and planning is the fit of the surgical guide. Using the Trios and combining that with Implant Studio gives us the best fitting guide. Obviously, the fit of the guide is incredibly important to make sure that the implants are going to end up in the same position as what we had planned. In this case, the implants at this point are now being delivered. The final implant is going in through the surgical guide. We have the final implant placement. On top of the final implant placement, we have our restorative components and then the provisional bridge that was manufactured prior to the surgery. And so the patient came in with no teeth and left with 3 incredibly strong teeth. A lot of doctors who believe that they don't need to go digital, first thing I would ask them is, then why do you use a cell phone? Why do you use a computer? The reasons why you go digital is to improve on what we're able to offer our patients. We're able to improve the workflow, we're able to improve the safety, the predictability, and the overall experience. I would say that the way that we used to work with our implants and plan our implants was much more of an analog style workflow, which really meant that when we were ready to get to the final phases, we would keep our fingers crossed hoping that we had the ideal scenario for the restoration, which wasn't always the case. The way that Trios and Implant Studio fulfill our implant needs is by taking what can be a very complex workflow and complex system and making it simple. Since our practice has gone digital, the workflow has improved where we've been able to eliminate a lot of the cumbersome steps, which really means that our patients are getting a better outcome with less appointments and less visits to the office. You guys provide the innovation, is what I love, and I love being able to implement it, and really trying to apply it, and it works great.